Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. I want to take a moment to talk to you about Aquoral spray, especially if you've been dealing with dry mouth after starting an antidepressant. If you've noticed that your mouth still feels dry no matter how much water you drink, it could be related to your medication. Dry mouth, also known as Xerostomia, is actually a pretty common side effect with many antidepressants and other mental health treatments. In fact, a large review published in 2023 found that dry mouth showed up in over 90% of cases where patients had any oral side effects from these medications. So why does that happen? A lot of antidepressants, especially those with anticholinergic properties, interfere with the signals that help your salivary glands produce moisture. These medications often block muscarinic M3 receptors, which are part of how your body regulates saliva. When those signals are blocked, saliva production slows down, and that's when symptoms begin. Some antidepressants are more likely to cause dry mouth than others. Tricyclic antidepressants, especially amitriptyline, have been shown to cause more severe symptoms. In clinical trials, amitriptyline consistently led to greater reductions in saliva compared to both placebo and other antidepressants. This is likely due to its strong anticholinergic effects. Other tricyclics, such as nortriptyline, have also been linked to reduced salivary output. SSRIs and SNRIs, which are more commonly prescribed today, can also cause dry mouth. These include medications such as sertraline or Zoloft, fluoxetine or Prozac, escitalopram or Lexapro, citalopram or Celexa, duloxetine or Cymbalta, and venlafaxine or Effexor. While the severity may vary, dry mouth is still a well-documented side effect with these medications, especially when used long-term. Now let's talk about why this matters. Saliva is more than just moisture. It plays a key role in protecting your teeth, helping you chew and swallow, and maintaining the natural balance of bacteria in your mouth. When there isn't enough, you might start to notice that food feels dry or hard to swallow, your mouth feels sticky, or you're sipping water all day. Over time, it can lead to more cavities, sore gums, bad breath, and even infections. For patients who wear dentures, dry mouth can make things more uncomfortable. Saliva normally helps keep dentures in place and creates a bit of a cushion between the denture and the gums. Without enough moisture, the dentures may not stay in place as well. This can lead to rubbing, sore spots, or even small ulcers where the denture presses against dry tissue, especially for older adults who wear full or partial dentures. That's where Aquoral spray comes in. Aquoral is a prescription treatment made to relieve dry mouth, including that caused by medications like antidepressants. It contains a patented ingredient called oxidized glycerol triester, or OGT. This is a lipid that allows it to mimic natural saliva. When you spray Aquoral into your mouth, it creates a thin film that coats the inside of your mouth, your cheeks, tongue, and the roof of your mouth. This film helps retain moisture and reduces the discomfort that comes with dry, irritated tissue. One of the biggest benefits of Aquoral is that it lasts 4 to 6 hours after just 2 sprays, because its lipid-based formula clings to the tissue unlike water-based rinses that wash away quickly. Clinical studies have shown some encouraging results with Aquoral. Around 73% of patients said chewing became easier and 65% noticed swallowing was less of a struggle. Even more, about 84% reported that their overall quality of life improved while using it. And one of the things we hear a lot is how simple it is to use. In fact, more than 85% of patients found it easy to apply and said it was well tolerated without any unpleasant side effects. To use it, start by gently shaking the bottle. If it's your first time, prime the spray by pressing it a few times into the air. Then spray it twice into your mouth and use your tongue to spread it over any dry or irritated areas. You can use it 3 to 4 times per day depending on how dry your mouth feels. Aquoral has no known interactions with other medications, so it's considered safe to use alongside antidepressants and most prescription treatments. Because it's available by prescription only, it also creates an opportunity to speak with your provider about how dry mouth has been affecting your comfort, oral health, or daily routine. If you've tried other methods such as lozenges, water, or over-the-counter sprays and still have dry mouth, Aquoral may be a more reliable option. It's specifically formulated to relieve medication-related dry mouth and works by keeping the tissues in the mouth hydrated and protected throughout the day. You can read more about Aquoral on our website, so check those articles out in the links below. If you have any questions, be sure to ask your doctor or leave them in the comments below. And don't forget to subscribe. Bye for now.